So today I'm going to talk about different symptoms that you might be starting your menopause journey. The scariest word ever, right? Now, there's so many different symptoms, and unfortunately, when you speak to people like your GP, they are not necessarily the best clued up on them. Now, your GP does a tremendous job with so many of the things, but menopause, there's so much to it, and sometimes it does require a little bit of specialist care and help. So here I am to talk you through it. Now, the first most common symptom that women experience is actually anxiety and depression, and this is down to the natural drop in your progesterone. Now, your progesterone is a hormone that helps stabilize your brain and your mood function. So one of the first symptoms as this starts to decline is anxiety. You may notice you become a little bit more irritable, maybe a lot more irritable. You may notice that you start to have like brain fog where everything feels a bit hazy, and you may also start to notice a little bit of things like memory loss. Now, these things are temporary, and hopefully they will, as your hormones stabilize, they will kind of ease off. Another serious symptom of it can be depression. So if you are struggling, do make sure you reach out, do make sure you're talking to your family and your friends so they know what's going on as well. Now, the more common symptoms that you'll experience may be things like hot flashes, which is, as it sounds, a sudden increase in temperature. This happens when your estrogen levels very suddenly drop and your brain kind of goes into panic mode. So it releases adrenaline, and adrenaline is your fight or flight hormone. So your body is prepared to fight saber with tiger when actually you're just sitting down for a nice dinner. So your skin temperature increases, you get really hot, you may also notice heart palpitations, and after about 3 minutes, after probably a load of sweat and you've stripped off everything, they should disappear. Other symptoms include sleep disruption, especially if you're having hot flashes at night. This can really mess with your sleep. And it's a bit of a vicious cycle, because if you've got sleep disruption, then you're going to have mood swings, you're going to be a bit cranky because you're not sleeping very well, and then because you're not getting enough sleep, your symptoms will get worse and worse. So the one thing to really bear in mind is that when you're going through this is to be really kind to your body. Other things include itchy skin, itchy eyes, dry hair might be thinning, you may get something that I like to affectionately call pancake butt. As you start to lose muscle, you may start to notice that your butt gets a little bit flatter. You may notice you have a little bit more weight gain around your middle, even if your diet and your exercise routine is exactly the same. You may start to notice you've got a strange taste in your mouth. You may have restless leg syndrome. You may randomly come into like sudden bouts of sweat as soon as like you step out of the shower, or random times like that. Like, there's so many different symptoms. So if you are at that age, well, you potentially look at being perimenopausal, and for example, your monthly cycles have got a little bit longer, you're starting to bleed heavier, maybe you're having more PMS, maybe your boobs hurt more than usual, then it could just be a sign that you are naturally starting to decline in your hormones. So those are some of the symptoms of perimenopause. Now, the list is endless because hormones affect your entire body. They affect your brain, they affect your metabolism, they affect your thyroid. Like, it has a knock-on effect to everything. So if you are starting to feel a little bit unwell, feel a bit unusual, do speak to your GP, get your bloods checked, make sure it's not anything else like your thyroid. And then if everything comes back normal, just accept that it's a natural part of life. Unfortunately, it can last for quite a few years, but be kind to yourself. It's an excuse to treat yourself. Make your partner do the hoovering, or if you don't have one, make your cat or your dog do the hoovering instead, and just enjoy it. So as always, make sure you tune into my Facebook page, where every week I go live at 8 p.m. UK time. And if you have any questions, send them my way.